Hi everyone, welcome to the Pain Management Strategies webinar. My name is Brittany Swanson. I'm an athletic therapist, personal trainer, and owner of Becoming Resilient Athletic Therapy and Training. I've had a lot of questions over the last little while about different pain management strategies, when and how to apply them. And so I figured I would just jump on here and give you guys a really good overview of the common things that we ask our patients to use on their own, and a couple of things that we can do with them, and so that you guys can make better decisions about how you can manage your own pain at home. So my goal with this webinar is to make sure that by the end of it, you understand what pain is, have an idea of why it happens, both acute and chronic, learn the difference between the two, and then we'll explore some different methods of pain control so that by the end of it, you kind of know, hey, this is what I'm dealing with. These are my options, and I think this one will be best. So I want you to leave here with that knowledge. That'd be really good. All right, so if we want to understand how we manage pain, we really need to understand what the heck pain is anyway. And we think we know what it is, but I think to give you a bit of a definition will guide some of the decisions that you make later on. So by definition, pain is an unpleasant sensation sent via a signal from the brain that's due to either real or perceived tissue damage, which results in physical or emotional reactions. These are things like spasm, you know, feeling anxious, the pain signal that you actually get, things like that. And then that reaction is interpreted by our conscious brain through the lens of our experiences, emotions, and mental state. So we just think, ouch, I cut myself, and the brain sends a signal of pain, and that's not necessarily the case. There's a lot of steps that go in to the whole process. And so pain management can kind of occur, we think at the surface level, but what it really does is we can affect pain at different levels based on where we are in the process or where we think we can have the most impact in the process. So then there's two different types of pain, and you've probably heard of people referring to both of these. Acute pain is your very typical, I rolled my ankle, I've got an ankle sprain and now I have pain. It happens right away. You tend to typically know exactly when it happened. And then it tends to resolve along the time frame of healing. So if it takes 4 to 6 weeks for, your second degree ankle sprain to heal up, then your pain will likely only last within that time period or a little bit less than that, because we know the last part of healing is more remodeling. So it's usually not very painful. Chronic pain, however, is typically pain that outlasts the normal healing time frame. So regardless of the pain you're experiencing, tissues usually heal at around the same rate, barring any sort of health complications, disease states, things like that. But so your chronic pain will be something that lasts past that point. It can persist for weeks, months, or longer. I mean, we all know someone who's had a bad back for the last 20 years. That would be considered chronic pain. Typically, the understanding is that if you have chronic pain, you still have an injury, but the truth of the matter is it's usually associated more with changes in the brain and nervous system than it is actual tissue damage. So again, like barring any complications, most people's tissue has healed. That doesn't mean that they shouldn't be experiencing pain. It doesn't mean that they aren't experiencing pain. It just means that we've got some other factors at play here. So you can start off with an acute pain problem, and depending on management and a bunch of other factors, it can become a chronic pain problem. Some people will never have what they consider an acute episode where they rolled their ankle or something like that, or bent over and felt a twinge. Some people just, they wake up one morning and something hurts and just keeps hurting from there. So that can make things a little bit complicated, but that's for another day. Most people don't get to that point or kind of have an idea of what caused the pain. Okay, so I kind of alluded to this earlier that, especially in the sense of chronic pain, but in acute pain as well, there are a ton of factors that influence your pain levels. So, we talk about someone's pain tolerance. And while we think it's just, the worst injury they've ever felt, and then they compare to that, it's actually all these other things that could change the way you experience your pain from, 1 minute to the next, never mind one day to the next or one injury to the next. So this list may seem a little bit overwhelming because you're like, oh, all these things are making my pain worse, and that really sucks. But it's actually a little bit more empowering than that, because you can think to yourself, okay, so I can ice, heat, whatever, but also like maybe if I change this, or I add this nutrient, or I focus on my gut health, or maybe do some internal mental work, that I can affect my pain levels positively. So the degree to which all of these things affect you is different person to person. People who have, really poor mental health and previous trauma and stuff like that are more likely to experience chronic pain than someone who isn't dealing with those things. People who are very active and their uh, their nutrition is a little bit more on point are less likely to have some of these chronic issues than people who aren't. But again, it depends on so many other factors, including, the injury itself, the education around that injury, stuff like that. In fact, I've had two people with the exact same presentation of their injury, and so for example, it was a disc bulge, and based on simply the fact that one person was told that they would never drive again, and the other person was told, hey, you know what, you'll be in pain for a little bit and then we'll work on it and things will be all good. Their outcomes are completely different. The one person that was told she would never drive again is now doing better, thankfully, because we're working together. But her period of chronicity, so the time that she was in a lot of pain, was a lot longer than the person who was told, hey, no worries, go get some physical therapy and you'll be all good to go. This person's time frame was 4 to 6 weeks, and this other person's time frame was a lot longer until we started working together. So it is very individual, which is why people are having a really hard time with how to manage this stuff. So I'm hoping to shed a little bit of light this week, and then maybe a little bit more next week. All right, so before we get into the actual management strategies, I want to give you kind of an overview of the different theories that we've had over the years about injury management. So everyone has heard this before. I grew up hearing this. Rub some dirt in it, shake it off, walk it off, whatever, you'll be all good. The more and more I learn about pain and chronic pain, the more and more I'm thinking back and going, huh, maybe my dad had something, he was onto something with what he was saying. But anyway, I will never tell him that. The common one that was explained to me or taught to me while I was in university was that there's this concept of secondary injury, where the body overreacts and creates the super crazy inflammatory response. And so we use the term RICEs, so rest, ice, compress, elevate, to prevent overinflammation. So that was kind of a more old school way of thinking. We're starting to learn now that that's not the case. The body really has a lot of checks and balances that are going to kind of railroad some of our efforts in that way. So as much as we think we can influence it by resting and icing and all of these things, we're learning now that the body's just going to kind of heal regardless. So the other theory that is often used, especially in cases that are a little bit more chronic, we talk about tendon issues and stuff like that, and how we have to encourage inflammation so that the healing process occurs, even though we're learning that, again, it's probably already healed. It's just the brain and the neurological system that has been impacted. But we used to say we're going to use modalities. So ultrasound, muscle stim, we would friction tendons, kind of dig in there to create inflammation so that it would bridge that gap and break through and then do the inflammatory process over and heal. Again, the literature is kind of all over the place with that. You can find just as many studies to say that it doesn't work as it does. And then the let the body do its thing, it's going to heal on its own. You've heard that too. It's kind of like that, rub some dirt in it, shake it off, it'll be fine. Most of these apply to acute injuries. Most of these theories apply to acute injuries. Only in recent years have we really been kind of nailing down management of chronic stuff. Again, we're getting there. It's a slow process. I'm trying to speed it up, at least in my world. But the overarching thing I want you guys to understand is we really can't influence the rate of healing. We can't speed up the rate of healing. We can slow it down by bogging it down with crappy food and poor management and overusing a tissue that you've already injured. But, we can't speed it up. The body has so many checks and balances. The reason why we start sweating when our body temperature starts to raise too much is because our body goes into overdrive and says, oh, well, we got to let go of the heat somehow. It's the same with healing. Okay, so that was stuff that applied more to the acute pain management theories. Here I've got some stuff about chronic pain management. So people have this idea that the body hasn't actually healed yet. You're chronic because, my tissues are still injured, my disc is still bulged, things like that. And it's very truthfully not a common thing to occur. Your body heals along a pretty common timeline regardless. They've got tons of charts online. If you want some, let me know. But these charts outline sort of each phase of healing, the inflammatory phase, remodeling, strengthening, things like that. And barring any complications in terms of chronic illness or disease, you're all going to kind of follow along that line of healing anyway. Now, the exception is if you keep going and doing the thing and re-injuring the tissue, that might be a case where it hasn't healed. But again, pretty rare. When we talk about chronic pain and the fact that it is a pathway to the brain and the brain starts oversending signals, because that's what happens. Your brain is super efficient. And so instead of checking, every 5 minutes or every day, whatever system it's on, thinking, okay, is this actually still damaged? Should I be sending pain signals? Your brain just goes, no, this person's still kind of walking funny, still guarding, so I'm just going to keep sending pain. What a lot of clinicians try to do is sort of break the sensory loop that occurs to help move past it. So we use things like muscle stim. Chiropractors use their adjustments where you get that joint reset. Topical creams where you put it on and it's an irritant and it heats or warms sends the signal of heating or warming the tissue. Heat, ice, massage, things like that are meant to kind of break that repetitive cycle and introduce another stimuli. The one that's pretty common is that your chronic pain requires medical intervention using pain management or an anti-inflammatory. I'll get into why I chuckle a little bit there later because I want to give you kind of a better overview of medications and what they actually do. But I'm just going to say that there are better ways for you to manage chronic pain than medication. Then the second last thing is that the system has weakened and isn't able to support the demands that you're asking it to do. So that's pretty common. We know that when we're in pain, we don't want to move a whole lot, regardless of whether or not we're an active person. So we get some muscle wasting, we get your joint capsules and tendons that tighten up and they get kind of dry and sticky so they don't move as nicely, and that can lead to chronic pain. The truth of the matter is it's a biopsychosocial problem, which means that there's a little bit of a lot of your body and the way the tissues are. So atrophied, your muscles are atrophied, your capsules are tight, blood's not flowing, that kind of stuff that can cause chronic pain. The psychological aspect. So we talked about the different factors, anxiety, depression, your education on the issue, things like that. And then the social aspect, right? So you're dealing with other people's perceptions, things that people have told you. Depression, I guess, could fall into this one too, especially if you've isolated yourself. But all of these things could contribute to chronic pain. And it's not to say that it's not the brain sending the signals, because it is. It's not to say that it's not the body. It's just we need to take a bigger approach to it. So I'll kind of touch on that a little bit in this webinar, and in the next one I'll go into it a little bit more as we talk about more alternative or non-medical management to pain. All right, so here's an overview of the pain management strategies. So I'm going to leave out the alternative or non-medical methods. I just wanted to highlight them here. The stuff that's on the left and then the anti-inflammatory medication is what I'm going to cover right away. I've kind of packed some things in together because they go well together. All right, this is the most common question I get from people. So there are people very much on one side of the camp and very much on the other side of what management strategy you should use. So we've all heard you get injured. Here is a ice bag, put it on, on for 40 minutes or 20 minutes, depending on who you talk to, off for double that time. You got to do that for 48 to 72 hours. Very, structured, and this is the way that we deal with injuries. And then there is the completely opposite theory where cold is bad and we're ruining the healing process and blah, blah, blah. I'm going to give you my take on this, and I think that it's a pretty general approach because there's just as many studies to say cold is the only way as there is to say cold is a detriment to an injury. So there is no perfect answer to guide any decision. Overall, other than if the tissue is hot and swollen already, you should use whatever feels good. The goal of what should be the goal of most pain management strategies is that we lower the pain a little bit and then we move, because as you'll learn a little bit later, ultimately movement and getting back to what we want to do is what's going to solve your problem. So try out either one. I mean, some people put cold on and then they feel awful. Some people put heat on and then they feel awful. Me being, close to 8 months pregnant, heat and I don't go well together. So I opt for ice right now. And it may change from body part to body part. So I find, other extremities like your arms, legs, ankles, wrists, things like that do really well with cold, whereas my back or your back may do really well with heat. So what I want you to do is try one or the other and then just take note. So, with the cold, you might find that the cold really numbs the area and you just need some relief. You just need to numb it out, get rid of it. And so I would recommend cold then. But if you want to kind of loosen the tissues, get some more blood flow in the area, feel like you can kind of stretch and move it, then I would say heat might be your option. So it's going to also depend what you're doing that day. So for example, at the end of the day and you're done, you had a full day of work and something's really sore, ice it down because you're not going to be moving a whole lot. I mean, ideally, you would do that at some point in the day or you've already done that. But if you just need to numb it out, use some ice. Now, if you wanted to do some of your rehab exercises, get some stretching in, or something feels really tight and you need to kind of loosen it up so you can move a bit more, you might try heat. Just pay attention to, first of all, what your goal is, but then how does your body react? The one caution is if you're dealing with a nerve issue, sometimes they don't like cold, they don't react well to cold. But again, that's super individual. That's just the experience I've had personally. So don't stress about heating something or cooling something. The reality is the level at which the modality heat or ice gets down to the tissues is very little. Like it's, you don't actually get down to the muscle with the cold that you think you do because, for one, your body's got all those checks and balances that will change the scenario if you're doing excessive of one or the other. But also, like, it's just you got a lot of layers there, and our bodies are designed to keep us warm or cool, right? So we don't like temperature change. So do whatever feels good. Don't let anyone make you feel bad about your decision. You should do that with everything in your life, really. All right, so I've lumped these two together because both topical irritants, so that's like your icy hot, your deep blue, your tiger balm, those things, and your muscle stim, so like the Dr. Ho, they both work to, I say confuse the nervous system, but they just send a different signal to the brain about what you're experiencing in that area. So for example, if my shoulder's sore and I put stim or a topical irritant on it, I'm just kind of interrupting the pain signal that I'm normally getting and providing it with either the heat or cooling of the topical irritant or the buzzing pins and needles tingling that you get with muscle stim. The idea is we do that and then we move. So the issue, a lot of topical irritants tend to be used so that people can move more. The issue that I have with the muscle stim is that a lot of people will use it as a cure for the pain. And a lot of practitioners, both physio, athletic therapy, chiro, whatever, will use it as the cure or the treatment. And the problem with that is it doesn't create any change. All it does is it sends a signal to your brain to kind of temporarily shut off the pain. So I personally have a really big problem with therapists who will set you up for 20, 30 minutes in a room with a muscle stim, and then maybe you'll get a couple stretches and then you have to move on. If that's the case, please find a new therapist because they should be getting you to do movement to strengthen and help the issue. We don't create change by throwing a patch on something. We create change by reinforcing the system and making it stronger. That's my little rant. All right. So massage and manual therapy, you can do this with a practitioner or self-treatment, especially in this era of COVID where it might be hard for you to actually get in to see anyone. But there are tons of different options. In my tele-rehab practice, what I do is I guide people through exactly how to do the self-treatment if they need it. It works really well, honestly. You can use tons of tools that you'd have at home, spatula, tennis ball from your dog, whatever, right? Like there's so many different ways that you can do self-treatment. Obviously, getting in to see someone is fantastic. You can swing that. I know at least where we are here, we're still in a state where we can go see someone. So if you're watching this from anywhere other than Winnipeg, Manitoba, right now we're at a stage where we can still access care, but a lot of people can't. So just know that you have options. These therapies are really good for areas that are holding a lot of tension. I find, there's a lot of people who think that, a lot of newer practitioners anyway, that think that manual therapy is overrated and it's not helpful and blah, 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 blah. There's a reason why massage therapists have been in business for years. It's because it works. So sometimes when an area is super tight and really guarded, so for example, you see people with the rounded forward shoulder posture, um, getting someone in there to manually stretch the tissue and loosen it up, or you yourself manually stretching the tissue can be enough to sort of break up that pain spasm cycle that can occur with chronic pain when your brain goes, ooh, I have an injury there, let's clamp down to protect it. So massage manual therapy can be really good. The caution I give you here is you don't want someone to be digging into an acutely torn tissue. So say you actually have a, second, even a first degree pec tear or strain. You don't really want to get someone to dig in there, and you really don't want to dig in there yourself. Don't start jamming your thumb in or a lacrosse ball or whatever the case may be. This is something where you give it a couple of days. You've gone through that inflammatory process and things are still tight and you need a little bit more help to get you moving properly. This is when you would introduce this. Now, a good manual therapist of any sort would consider the timeline of whatever you're dealing with and make a good judgment call about that. But you also have to sort of advocate for yourself. So say you've got a massage book, you just hurt yourself, maybe, work on something else in the meantime. But I always recommend that you, like every other like every other pain management strategy, you use this paired with movement because that's what's going to help your problem. Right, this is my favorite part. If you have followed me for any length of time, you know I'm a big proponent of movement. I very much believe that regardless of what your primary pain management strategy, the only way that you're actually going to solve your problem, whether acute or chronic, is by moving and strengthening the tissue. So why movement is important comes back to what happens when you're in pain. So you have an injury of whatever sort, and your brain goes, oh no, we need to tighten up. So, for example, I picked up something heavy, I twisted to 20 degrees, and then I felt a twinge, injured my back. So, I strained something in my back. Doesn't really matter what it is. All right. So now my brain goes, okay. So, around 20 degrees of rotation to the right, I hurt myself, or my person hurt themselves. So I'm just going to turn the brakes on around 30 degrees. So even more of a rotation, less than that. It's going to start turning on the brakes to prevent you from doing it. So, sorry, I'll explain that a little bit better. It narrows the rotation that you're able to do because it doesn't even want you to get close to that oh no spot. So the brain goes, nah, we're going to turn the brakes on. We're going to tighten everything up around that area because we need to guard it. And initially, if you've actually done some damage to the tissues, this is perfectly normal. The unfortunate part is if you let that pain spasm cycle happen for too long, what it does, your brain does, is it just keeps sending that signal. Remember, it's super efficient. It doesn't like to think very much. It's got a lot of jobs. It's got to regulate all your organs, never mind this injury you just throw at it, plus all the other mental stuff that's going on. So the brain just goes, nah, we're done. We're tightening up. I'm going to send pain and let you know before you hit that point that this is a no-go zone. And the only way that we can break those signals is by moving in a safe way. So all of these pain management strategies, and the ones I'll talk about next week, are designed to lower the amount of pain or get rid of possibly the amount of pain you're experiencing. So the brain goes, huh, okay, so maybe things are getting better and I can move a little bit more. So movement will encourage blood and fluid flow. What that does is it helps relax the tissues. It tells the joints and the joint receptors, okay, we got this. We can move. We're feeling good. We're feeling loose. And then you can start strengthening things a little bit more. I tell my patients that when you start moving, you want to stay below a 4 out of 10 for pain level. So anything below that discomfort kind of thing is okay. But the thing that you want to watch for when you start moving is that sharp stabbing pain. This may not necessarily indicate any tissue damage, but this is something where if you're starting to get sharp shooting pain when you do something, that you want to check in with a therapist about. And by therapist, I mean physical therapist or an orthopedic doctor if you're working with one. But typically those are the people that you see if there's fracture or, second, third degree strain, things like that. What I would recommend and what I start my clients with is an isometric movement. So what that means is isometric means that there's no change in the tissue length, but there's still contraction. So for example, if I were to prescribe someone an isometric movement for their neck because they have whiplash, what I would say is you're going to use your hand, you're going to apply pressure to your head, you're going to use your head to press into your hand so that there's a contraction in the muscle, but there's no movement. So you're not pushing harder with one side or the other, you're meeting the resistance and then you're holding. Right? So isometrics are super safe movements to start off with because there is no movement of the tissue. In fact, and only do this under supervision with a physical therapist, but what you can do, even in the case of having a fracture, say, any bone that's in a cast, you can do some very, very mild isometric contractions so that you're still getting those contractile proteins working, but you're not moving the tissue and risking, opening up the fracture. So again, caution, only do this under supervision of a therapist if that's what you're dealing with, but just know that it's a possibility. The other thing that works really, really well for people who are dealing with pain, especially chronic pain, is eccentric movements. So eccentric movements are kind of like the lowering phase of the movement. For example, if you're squatting, it would be the lowering phase of the squat. So if I was going to tell someone to prioritize the lowering phase of the squat, what I would say is, you're going to have someone, you're going to, stand up from your squat. You're going to have someone give you a dumbbell in your hands. You're going to hold that dumbbell. You're going to lower down, and then you're going to get someone to grab the dumbbell from you. So you're loading up the eccentric or the lowering phase of the movement. I've got a really good exercise on my Instagram that I posted of doing this for the back. So I'll just give you a brief explanation. An eccentric for the back would be that you push up into a baby cobra position. That's a common yoga move. And then you remove your hands and then you slowly lower using your own muscles. So this one works really, really well to bridge the gap for people from doing nothing to being able to strengthen their muscles of their back. When we're talking about pain, especially chronic pain, we want to prioritize strength because strength is what's going to support that system. If your nervous system feels like it's strong, then it's going to relax a little bit sooner because strength equals stability, which means that you're safe. The way that you can do this is with lower reps, which is great because it creates less muscle damage, less DOMS or soreness, and less soreness. In your mind, it's going to be read as less pain. I also really recommend adding weights as soon as possible, even if it means you're doing 2 to 3 reps and then taking a break, and then 2 to 3 reps more and doing a couple sets of that, because again, now you're prioritizing the strength aspect of it. The more likely your nervous system is going to go, oh yeah, like I'm strong enough to handle this. Understand that there may be a flare-up as the body adapts when you start doing these things. So especially if you've got a chronic problem, it's been there for a long time, getting back to a state of no pain is going to require you to do a little bit of a push where it's going to suck before it gets better. I need to warn you because then you won't start doing things and go, oh crap, like I'm obviously doing something wrong. Nope, your body's just adapting. So if you really need help to push past these, hire someone, work with someone who can kind of judge, okay, how much soreness is too much soreness, but know that you're going to go through something like a flare-up as your body adapts. Generally speaking, if it's an acute injury, what I would suggest is, people will say, here, take some Advil, Tylenol, rest for 2 weeks, and then start moving. I would highly recommend that as soon as humanly possible, even that day, you start just doing general activities of daily living, walking around, very, small bends, twists, movements, whatever. Don't just rest and keep the tissues, if it's your wrist, keep it stationary like this. Don't put it in a brace for the most part unless it's really severe, because that will cause everything to tighten up, less blood flow, the tissues tighten up, and then you get more pain. All of this information obviously doesn't necessarily apply if you've got a fracture or second or third degree tear where the tissue's really damaged. Please, 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 if you think that is the case, go and see someone. Go and see an orthopedic doctor, not just your general practitioner, because they have no idea, or go see a physical therapist first, and then they can kind of guide you from there. Okay? If you have questions or not sure where you fall, please get in touch. Okay, so here's just a quick overview of the alternative pain management stuff that I'm going to talk about next week. I want to make sure that you guys know that I'm going to touch on it, especially if you followed me for a while. You know that I use a lot of these things with my patients. Yeah, first line of defense might be typical management with heat, ice, and movement, but there are other things that you can do to help, especially in chronic pain management. Okay, so I say alternative, and again, because there's still some stigma around some of these things, but these are all things that people are using in chronic pain once they get to the point where they have to go see a pain clinic. So these non-medical or alternative strategies include things like acupuncture, acupressure, reflexology, mindset, and emotional therapy or behavior therapy, things like breath work, meditations like the body scan or contract relax meditations. We say meditation, but it's just a practice. It's not super hokey. Like, this is something that is very commonly used in this setting. But these things should be considered before many other interventions. And unfortunately, they're not a part of our current medical model unless you get to the point where you're so chronic that nothing else works and then you get sent to the pain clinic. We would avoid a lot of those referrals and a lot of months and years of pain if we started introducing them a little bit earlier. But for some reason, they are considered a last resort. And because of that, they take a little bit longer to work, which sucks. But the goal of a lot of these techniques is to impact pain signals at their source. So again, we talked about the process of pain is actually mostly in the brain. Not to say that it's not a very physical thing that you feel, but a lot of it stems from up here. In fact, if you didn't have that pathway, you wouldn't ever feel pain, even if you did something like cut your hand off. The other thing that we talk about in the next webinar will be things like nutrition, and anti-inflammatory diet, stuff like that. And the goal of that would be to create an optimal environment for healing, and then you just let your body sort of do the work. So next week we'll really get into that. If you have questions before then, please send them to me so I can make sure I include that stuff. Oh, I might have forgotten the medication slide. So I'll just give you a quick overview. Maybe it happened to skip, but medications like Advil and so NSAIDs, non-steroidal anti-inflammatory drugs, or any anti-inflammatory drugs, are often prescribed right away. The problem with that is realistically they should be used very limited. NSAIDs, or the anti-inflammatories, they shouldn't be used in the first little bit because, again, if we interrupt that inflammatory process, we can create some problems. And these medications are so good at doing that that it actually can have an impact on your system. The other thing is Advil, naproxen, things like that can create rebound inflammation. So once you stop taking them, you get more inflammation, which means more pain. They can create things like leaky gut, autoimmune disease, intestinal bleeding, and nutrient deficiencies, which are going to make pain, especially chronic pain, worse. If you find that you're in pain and you've taken an anti-inflammatory and it helps, that you might want to look into some other anti-inflammatory things like nutrition that are going to help systemically lower your inflammation, but also don't have those awful side effects. So we'll talk way more about that next week, but I just want to give you that. The other thing with Tylenol or pain management medications is that they can be very hepatotoxic, which means that they're very toxic to your liver. And we know that, long-term use is a problem. You can cause things like ulcers and issues with your stomach lining, stuff like that. So I want you to know that there are other, even if those work, there are other things that you can do to fix your problem. So we'll touch a little bit more on that next week, but to recap today, pain is an unpleasant sensation due to real or perceived damage, which results in physical or emotional reactions, and it's a signal from your brain that you interpret. There's tons of theories of pain management, but the body is pretty good at healing on its own. We just kind of have to help it along by strengthening it after. You can use heat or ice depending on how your body reacts to it. There's no real hard and fast rule other than don't heat a really hot swollen area because that's going to make it worse. Sometimes pain requires something to kind of break the signal so you can get past it and start moving. Stim, topical irritants, massage, chiro, all of those things work really well for that. I would put acupuncture in there as well because people have found that really helpful. Use medications with caution. Sometimes they're needed, but weigh the pros and cons. So, we'll talk about it more next week, but understand that there are other ways to manage your pain than meds, other ways that aren't going to give you the same side effects. And then all non-medical pain management, even the stuff we talked about today, other than the medications, should be considered before we talk about things like meds, surgery, all those drastic measures. There are a lot of things that we can kind of cross off the list before we get to that point. So I hope that you learned a lot from this webinar. If you have any other questions, don't hesitate to send me an email. I have some blog posts on the website there if you want to check out some more stuff. I've got one coming up right away to talk about the way or the reason why movement is so helpful. So it really breaks it down if you want a little bit more of an overview of that. But yeah, so send me a message if you have questions for the alternative or non-medical pain management strategies for next week. Please send me a message, whether that's on Instagram at Too Grit to Quit or an email, and I will make sure that I throw that in there before next week. All right, so hope you all have a fantastic day. If you want to reach out and get in touch about your specific problem, do not hesitate. I'd be happy to talk about it. Bye, guys.